Thursdays, this segment of the show we like to call What's Up Doc, where we've been spending some time with the fine people at Mercy Health and learning all kinds of things from all sorts of different medical disciplines, and great doctors taking time out of their day. Now, they end up regretting spending some time with us, but, up until that point, we have a great time.
They gave us a brain surgeon today.
Yeah. Well, they figured that they would go well outside our wheelhouse because, radio morning show host, brain surgeon shouldn't probably be in the same sentence ever, but it is this morning. Neurosurgery, a complex medical specialty offered conveniently right here in Rockford. Mercy Health neurosurgeons have evaluation and treatment for a wide range of neurological conditions, including brain and spine treatment. And we're going to talk a little bit about that right now with Dr. Mohammed Janjua. And he's on the line with us right now. Doctor, good morning to you.
Good morning, everyone. Thanks for the opportunity to be with you guys today. Thanks so much.
Well, we're glad to have you on. Tell us a little bit about yourself.
I am, as you just alluded to, I'm a neurosurgeon and certainly been trained in this specialty for years. And I think for me, neurosurgery is more than a career or a job, and this is a vocation for me. I really like neurosurgery because patients come in, they're really scared of their initial diagnosis or they have gone through a trauma. And I think the stress level is very high and decision-making is very weak at that time, and they just really look up to you for definitive treatment or management when they find no other solution. And I think that drives me to be there for my patient no matter what time of the day it is, and try to help them out and try to do best job so that I can help them get cured and try to find a solution for their problem. So I think this is what beautifies this specialty, and that's why I've always been drawn to it.
Is this something you always knew that you wanted to do, or was medicine the first thought, and then the specificity of being a neurosurgeon came later? How did that come together?
Yeah, that's a great question. I think when I was in the med school, certainly I was able to find an interest in other specialties too. But as soon as I stepped into the operating room, I think it's a whole different new world, and I was just drawn to neurosurgery. Because of the complexity of the procedures and the delicacy which was involved in the management. And there's some broad range of pathologies that we treat in neurosurgery. I think one day you are operating on the brain tumor, and the next day you are doing a massive spinal trauma, or you're dealing with a spinal cord injury, or the next day you are dealing with a high pressure in the brain. We call it hydrocephalus. So I think I was really attracted to that complexity and a broad range of pathologies involved, and how to put everything together and to be able to solve those different questions that comes to your mind, and how you're going to help those patients and how you can find a solution to their problems.
How long have you had the title neurosurgeon?
This has been a little relatively new, I would say. I've been in practice for about a year. I concluded my training last year in June, and since then I've been practicing.
What would be the neurological conditions you do treat?
Neurosurgery is, as I explained, a very broad range. We are all trained in different subspecialties during our training. I would say I had an opportunity to get trained with people who were treating a lot of more complex pathologies. So it ranges really from a brain tumor, we call it neuro-oncology, to more complex skull-based tumors, where you go into the base of the skull and treat those tumors invaded into different areas of the brain base, to the pressure in the brain, we call it hydrocephalus, and even to the seizures management, or we call it epilepsy surgeries. And then on the other side, there's another subspecialty that I'm trained in is spine, where we call it a complex spine. It involves spinal pathologies, which could be a minor or disc herniation to a more deformed spine. So I treat scoliosis as well, and as more complex spinal deformities. So it's just a broad range from brain pathologies to the spinal problems.
You kind of alluded that a lot of problem solving, figure out puzzles in your job. I'm assuming a lot of interaction goes with other doctors. How often do you talk to other medical professions that are dealing with a patient? How big is the team before it gets to the neurosurgery aspect of an operation?
Nice. I think it sort of starts in a different triaging services. So it depends on the pathology. A lot of patients are transferred from the other facilities through the ER, or we call it emergency room, or they just walk into the emergency room with an acute condition, which could be increased pressure in the brain, like nausea, vomiting, or they have an altered level of consciousness. This is the one route where they walk into the hospital. The other route is they usually walk into the clinic. And the third route is a direct transfers, where patients different physicians in different areas would just call us. It could be a neurosurgeon or a neurologist calling me to transfer his patient because he thinks this patient can be better treated at a big facility or a level 1 trauma center. So different triaging services involved in terms of when patients get to see me, and sometimes they are our general surgeon. We call them trauma surgeons, and sometimes they are called first for pathology, and they do immediate imaging. For instance, someone fell off of a ladder and is having an altered level of consciousness, so they're going to do a multiple imaging, and then they'll see, oh, here it is. There is some fracture there, or unstable spinal fracture, or a head bleed which needs to be addressed, and they'll call us right away. In rare situations, it could be a critical care physician who could be calling me for a second opinion regarding he did brain imaging like an MRI or CT, and it shows a mass or a lesion in the brain, and now he needs my help. So it's sort of different ways to come to a neurosurgeon.
It would seem to be, and it's spoken by a total layman here, this would seem to be a very, very high stress position.
That's correct. I think, and this is what draws to me, I think neurosurgery is very full of stress. Even in the operating room where the stress level is very high, it's just like a box where you put everything on the side and you just focus on surgeries. How I manage stress, I think this sort of probably comes with your built in your personality. That's why you pick up neurosurgery, and then over time a lot of sacrifices involved in your personality where you just stay very calm and focused, and you take time, and you got to believe in yourself that you have been enough trained to handle this. Sometimes this could be a multitasking that we have to do. It's just not one area where we're just doing surgery and we're just managing other patients, or my pager is ringing all the time while I'm operating, and there could be 2 or 3 patients in the ICU waiting for my next step of management, or it could be a physician looking for me for a small question to a more complex question. So I think that's how you get trained over time, and you get better trained how to do multitask and how to handle stress.
Doctor, I have an idea. I'm not saying I do it, but I have an idea how to keep my heart healthy, how to keep my lungs healthy, how to keep a lot of parts of my body healthy. I don't know how to keep my brain healthy. Is there something I can do to help my brain out? Do we know enough to give that kind of advice?
That's a very good question. I think the common saying, healthy brain, have a healthy body. I think you're right. Certainly, there's no way to really quantify your brain health. But there are certain conditions, there are certain things that we typically see, unfortunately, these days that pose a lot of risk to brain health. For instance, and this has been proven with a lot of old and current literature, smoking, alcohol abuse, and use of these drugs. I think those are the things that have a strong association with a lot of complex pathologies in the brain or head bleeds. Given the fact someone stays away from these things, and then what next? Then keeping a very good control of your blood pressure, cholesterol, and staying a healthy life and doing a physical exercise is very, very important. These things can really affect your health, yes, and how much they can improve your mental health is also incrementally related. But apart from that, there are other things that are beyond our control, or they're pretty sporadic, like brain tumors. So, unfortunately, there's nothing no one can do about it. It just has either familial strong predisposition, or this could be sporadic mutations in the genes because of some viral influences, and you certainly have no control over that. Or a trauma, which is unfortunately very unexpected. It could be on the roadside and someone got hit by someone, and unfortunately then it ends up into a big problem for their either spine or brain, which will need a neurosurgeon. So certainly there are things that we can control, and there are certain other things that we cannot control, and will need our services.
Well, Doctor, we have all the respect in the world for you and for what you do. For people who are tuned in, how do patients go about making an appointment with you?
Thanks. I think patients, we are based in Mercy Health, which is a Riverside hospital in the city of Rockford, and there's my clinic. Patients can certainly reach us making a call to the clinic. Our number is 815-971-1842, where they can talk to my nurse in terms of the immediate referrals if they have, or if they need help, and we'll be available to help them the best way we can.
Outstanding. Doctor, we really appreciate you taking time out of, well, you know, it is a very, very busy day for you every single day. Thanks a lot. Thanks a lot for the information. Thanks for sharing with us, and have a great rest of your day.
Thank you. My pleasure.
We appreciate it. That's Dr. Muhammad Janjua. He is a neurosurgeon with Mercy Health.